Well, today is National Wear Red Day. Matt Hooper is the Communications Director for the Birmingham office of the American Heart Association. He is here along with Dr. Michael Bailey from the Birmingham Heart Clinic to talk about this today. Gentlemen, good morning.
Good morning. Thank you for having me.
We all have our red on.
Exactly.
And so this, how many years ago did this start?
This started in 2004, and really the whole point behind Wear Red Day is it's an awareness day primarily for women. Of course, heart disease is the #1 killer of all Americans, men and women.
Right.
But women, there was really a gap between their recognition of heart disease as their #1 killer. Roughly 1 out of every 6 women today recognize heart disease as the #1 killer. However, 1 out of every 3 women that die this year will die as a result of heart disease. So there's a gap there. And we're trying to raise awareness today, obviously by wearing red. The goal is you wear red, somebody asks you, hey, why are you wearing red? You say, well, because heart disease is the #1 killer. It's preventable. Go to goredforwomen.org and find out how to do that.
And it is funny because red is one of those colors that people will go, oh, you look so good in that red today, you know, and so that gives the opportunity for the conversation. So why is there that gap for women when it comes to heart disease that he talked about?
It goes back into medical research, and the problem with medical research is that we used men forever as primary subjects. So even from the beginning, when we started to expand our knowledge base as far as how heart disease works, it was mostly done and studied in men. So we know very well how a man would experience chest discomfort or maybe symptoms of a heart attack, but women weren't that well studied. So recently and through the 90s and 2000s, we began to expand our knowledge base a bit and learn that, like every married man knows, there's a big difference between men and women in every single way, especially in how they exhibit their symptoms of heart disease.
Well, let's talk about the symptoms for women in particular.
And they can be just exactly the same as the man's symptoms. You can have pressure and tightness in the chest, shortness of breath, sweaty, clammy feelings, radiation into the arm with numbness and tingling. It doesn't have to even be pain. Or fatigue, or nothing. Remember, 50% of heart attacks are silent in both men and women.
And is it true, can women have, they'll feel something in their back sometimes?
A lot of times between the shoulder blades, the jaw can hurt, or neck, or have a headache. But still, the textbook tightness, we see that a good amount, but it can be as subtle as, I just don't feel so good, and I'm just sweaty, and I've got a feeling of, some people think of it as impending doom. So your suspicion has to be very high. Given how many people in the population have heart disease, we think of it quite often when anybody comes in with oddball complaints.
All right, Matt, let's wrap this up with, I know it can be kind of heavy, but we don't want to make it too heavy because we want people to be aware, but talk about it and make it a better conversation than waiting too late.
Exactly. You know, the 1 in 3 statistic is pretty heavy, but there's another statistic that we use that's very positive, and that is 80% of cardiovascular disease is preventable simply by, you know, first of all, knowing where you stand. What are your numbers? What's your blood pressure? What's your blood sugar? What's your cholesterol? And you know, also getting more exercise. I mean, get out and get active. You know, 5 days a week, 30 minutes a day. You can really mitigate your risk for cardiovascular disease and heart disease if you do those 2 things. Eat better and get more exercise.
All right, we all can do that. Matt and Dr. Michael Bailey, thank you so much.
Thank you so much.
All right, we have our red. Mickey Ferguson.
Hey, how come you're wearing that red today?
You know,